This is the radial artery puncture procedure. First, you want to obtain your equipment. So that includes a syringe kit for ABGs, syringe, needle, point lock, your air filter. You want to make sure you have some sterile gauze and an alcohol swab. Once you have obtained your equipment, you can verify the order. And you want to make sure that your patient's not taking any anticoagulation medications. If their vent settings have been changed, then you want to wait 10 minutes for a patient who doesn't have an air trapping disease, and you want to wait 25 minutes if they do have an air trapping disease. Then you need to check for clotting times. If all of that is okay, then you can go in, introduce yourself to the patient, inform them of what you're going to do. Then you want to wash your hands and put gloves on. After you do that, after you put on your gloves correctly, you're going to choose the location of your puncture, and that involves doing an Allen test to test for perfusion. So that includes blocking the ulnar and the radial artery and having them pump their hand 5 times. Once they've done that, there shouldn't be really very much color in their palm. You're going to let go of the ulnar artery, and it should return to pink in their palm within 8 seconds. So once you've done that, you're going to choose the radial artery, find the pulse with your non-dominant hand, like so. Then you want to clean the site, and you want to rub to make sure that you get it good and clean. You want to make sure you get your fingers too. After you do that, open the sterile gauze, just have it ready on the patient's arm. You want to make sure if your needle doesn't already have it in the package that you aspirate some air in there so the blood has somewhere to go. Then you want to open your needle. Palpate for pulse. And you want to go in at a 45-degree angle with the bevel up. And make sure you warn the patient before you stick them. As soon as you see the flash of blood, you're going to hold the syringe still until it fills up. This one's not really filling up that much. Then you're going to grab your gauze and pull the needle out and apply pressure for 5 minutes. Then you can put it in the point lock. And do that. Place your filter. And make sure you get all the air out, like so. And then you want to rock and roll to make sure the heparin mixes with the blood so it doesn't coagulate before you get it to the ABG. Once you do that, let's say it's been 5 minutes, you're going to label the syringe with the patient's FiO2, the room number, date, time, and then you're going to put it in the biohazard bag, and you can also put a label on that too. And then you want to make sure your patient's okay, make sure they're comfortable. Then you want to go analyze your sample and then document. And that's it.